So 5 years ago, Secours Mercy Health decided to take a centralized approach to a transfer center because what we had in place was very fragmented. Healthcare is delivered locally, and we try to make sure that we have local solutions where appropriate and where it matches the market. However, for something like transfer, it's very, very complex, and oftentimes can be 5, 6, 8 calls. It really creates a challenge for our emergency departments. It creates a challenge for our admission folks. And as we looked at it, we were able to bring the right talent in with Dalton-Norman and a couple other key leaders that helped us really envision what a state-of-the-art contemporary transfer center could be. And we started this journey in 2017 and started looking at how we could centralize this function in a way that it created, for lack of a better term, an easy button for our emergency departments to really help get patients to the right point of care at the right time with the right physicians.
The most important reason we want to transfer a robust transfer center is really for our patients. We owe it to them to coordinate their care and to make sure that they're taken care of from the beginning of their stay to the end. Along goes with that is we're going to earn the right for their repeat business as needed and their family. And so having a highly regarded partner like Conduit manage that for us is invaluable.
The value that Conduit brings from a patient perspective is the ability to coordinate all of the pieces related to that transfer in one single phone call. So while the patient probably doesn't see all the calls that happen behind the scene, they will experience a more streamlined process, and very likely, in our experience at least, they will see a shorter time to be transferred from an outlying facility into our facility or vice versa, because we have that ability to coordinate all of the pieces needed, whether it's transport, whether it's a bed, whether it's reports that need to happen before a patient moves. That ability to tailor the clinical protocols to the local market conditions and the ability to provide data and analytics and recording of these calls made it very easy for us to deploy across a larger footprint, particularly across all of our markets, where different service lines have different priorities. You have different services offered by the facility, whether it's secondary or tertiary center, whether we have some specialized services available or not. So all of that was able to be integrated in a single phone call. And from a consumer side, the end user on the referring side, they call one number, they submit all their information, and then we take care of the rest. There's also the ability to connect you with the referring providers. So if a physician that is on the floor is admitting a patient later in the evening, after that patient had already come there and they had a question, they had a test result that they don't see, they had an image that they don't have, they have the ability to call Conduit and say, just connect me with the referring physician, and Conduit would take care of that. They don't have to look up a phone, they don't have to look up a number, they don't have to try to figure out, frankly, they don't have to even know who that referring physician. They can just call Conduit and say, can we connect with who sent this patient in here? That streamlines the process significantly and avoids the multiple calls.
Myself as an administrator or a leader in the organization, did not realize how much GI patients we were transferring out. And we were able to drill down with the Conduit team and understand there were certain facets within the GI subspecialty that we didn't offer. And we saw that was a procedure called ERCP. And so we brought ERCP into our organization, and the GI transfers disappeared. All those patients leaving the hospital, leaving the market for services elsewhere didn't have to leave the market anymore. We were able to keep people close to home, close to their families, and close to their loved ones.
One of the great values I've seen from working with Conduit is really the insights on actionable data. As a financial leader, anecdotes are great, but data is invaluable. So a lot of the reporting that we get from Conduit, and some of this is daily, some of it is monthly. The vast majority of it's actionable, and we take that data and put it into a governance type structure with our local markets to make sure that whatever we're seeing as opportunities, that information and those insights are getting to our market leaders to take action on. And this is a cadence whereby we repeat every month. We're looking for continuous improvement And thus far, we continue to improve even to some very high standards.
I would highly recommend Conduit Health Partners to any healthcare system that is looking to improve the performance of the transfer center or that has a struggling operation. And to some extent, that is looking at an opportunity to increase their market share out of these transfers.
I would wholeheartedly recommend Conduit for transfer services for any acute care health system that's looking to solve the challenges that are complex and many, or to have smooth, seamless transfers from their EDs into their network.